Most people with a pinched nerve in the neck try to stay as still as possible and wait for it to get better. But in most cases, the right kind of movement is exactly what the nerve needs. Today, I'm going to show you 7 exercises that move the pressure of the nerve and get you feeling better faster. A pinched nerve in the neck does not always just cause neck pain. It can send pain, tingling, numbness, or weakness all the way down your shoulder, your arm, and into your fingers. For a lot of people, especially those who sit at the desk all day, this starts gradually and then gets worse over time. It is not something you have to just live with it. My name is Jan Sosnowski. I'm a physiotherapist working in Dubai, and I help people with neck and nerve pain get back to feeling normal. I had a patient, 30 years old, a desk worker with severe numbness and tingling from his shoulder all the way down to his fingers. A few weeks of these exercises and every symptom was gone. I'm going to show you 7 exercises you can do sitting in a chair with no equipment at all. But before we start, there is some important information you need to know. Here is what's happening. Between the bones in your neck are small spaces where nerves exit and travel down into your arms and hands. When posture is poor, those spaces narrow and the nerve gets compressed. That is what you feel as pain, tingling, or numbness down your arm. The first 4 exercises open up that space. Some neck discomfort during those movements is fine, but if pain shoots down your arm, stop immediately. The last 3 glide the nerve to free it up, and the mild pulling or slight tingling in your arm during those is completely normal. That patient was dropping things, struggling to type, and waking up at night with tingling in his fingers. Once he started doing these exercises every day, the symptoms reduced week by week until they were completely gone. He was back at his desk working normally with no pain and no numbness. That is what consistent movement can do. Exercise 1. Shoulder blade squeeze. When you sit at the desk for long periods, your shoulders tend to roll forward and your upper back runs. That forward posture puts extra pressure on the bones and nerves in your neck. This exercise pulls your shoulder blades back and corrects that posture, which immediately reduces the load on your cervical spine. How to do it? Sit upright in your chair. Squeeze your shoulder blades together as if you're trying to hold a pencil between them. Hold for 5 seconds. Relax and return to the starting position. Repeat 10 times. If pain shoots down your arm at any point, stop immediately. Exercise 2. Chin tuck. Most people with a pinched nerve in the neck carry their head too far forward. For every inch your head sits in front of your shoulders, the load on your neck roughly doubles. This exercise brings the head back over the shoulders, opens up the spaces where the nerves exit, and takes the pressure off. How to do it? Sit upright in your chair. Squeeze your shoulder blades together as in exercise 1. Look straight ahead, keeping your eyes level. Use 2 fingers to gently push your chin straight back, creating a double chin. Hold for 5 seconds. Relax and return to the starting position. Repeat 10 times. Stop if any pain shoots down your arm. Exercise 3. Neck extension. This builds directly on the first two exercises. Once your posture is corrected and your head is back over your shoulders, tilting the head backwards helps push the irritated tissue away from the pinched nerve. This is particularly helpful if your symptoms travel down one arm. How to do it? Sit upright in your chair. Squeeze your shoulder blades together. Tuck your chin as in exercise 2. While keeping that chin tuck, slowly tilt your head backwards. Hold for 1 to 2 seconds. Return to the upright position. Repeat 10 times. If you feel pain shooting down your arm at any point, stop and return to the upright position. Exercise 4. Neck extension with rotation. This exercise takes everything from the first three and adds a small rotational movement at the end. That rotation helps mobilize the specific joints in your neck where the nerve is being pinched, freeing up that space on the affected side. How to do it? Sit upright in your chair. Squeeze your shoulder blades together. Tuck your chin. Tilt your head backwards. From that position, move your head to the left, hold for 1 to 2 seconds, then move it to the right, hold for 1 to 2 seconds. Repeat 5 times to each side. Again, if pain shoots down your arm at any point, stop immediately. Exercise 5. Median nerve glide. The median nerve runs from your neck down through your arm and into your thumb, index and middle fingers. When it gets compressed or stuck, you feel tingling or numbness in those areas. This exercise gently slides that nerve through its pathway, like flossing between teeth, freeing up any area where it has become cut. How to do it? Hold your arm straight out to the side with your palm facing upward. Keep your shoulder relaxed. Bend your wrists so your fingers point toward the floor. Slowly extend your arm slightly backwards, continuing to hold the wrist bent with fingers pointing down. From that position, tilt your head away from the outstretched arm, bringing your ear toward your opposite shoulder. Then, bring your head back to the middle. That is 1 repetition. Keep moving your head back and forth in slow, controlled rhythm. A mild stretch or slight tingling in your arm is completely normal here. Repeat 10 times. Exercise 6. Radial nerve glide. The radial nerve runs down the back of your arm and into the back of your hand and thumb. When this nerve is under pressure, you may feel aching in your elbow or the back of your hand. This exercise glides that nerve through its full pathway to release that tension. How to do it? Hold your arm straight out to the side with your palm facing downward. Keep your shoulder relaxed. Rotate your palm away from you so it faces the wall behind you with a slight bend in the wrist. Move your arm downward and slightly backwards. As you do that, rotate your entire arm inward about 30 degrees so your fingers turn away from you. To increase the stretch, tilt your head by moving your opposite ear toward your opposite shoulder. Glide the nerve by moving your head back and forth in a slow, controlled rhythm. Just like the last exercise, a mild pull or slight tingling is expected. Repeat 10 times. Exercise 7. Ulnar nerve glide. The ulnar nerve is responsible for the feeling in your ring finger and little finger. If you get numbness or tingling in those two fingers specifically, this is the nerve involved. This exercise glides it through its pathway from your neck all the way down to your hand. How to do it? Make an OK sign with your hand by placing your index finger on top of your thumb. Move your arm out to the side and bring your elbow back behind you. Rotate your hand so your fingers face toward the floor. Then place your little finger just behind your ear. Gently push your elbow further back until you feel a mild stretch. To increase the stretch, tilt your head toward your opposite shoulder. Glide the nerve by moving your head back and forth in slow, controlled rhythm. Slight tingling or stretch in those two fingers is normal and safe. Repeat 10 times. If this video helped you, subscribe and let me know in the comments what you would like me to cover next. I read every comment and it helps me make the right videos for you. A pinched nerve in the neck can feel frightening, especially when the symptoms travel all the way into your hand. But in most cases, the right movement done consistently is all it takes. You just need to know what to do.